let's do the hand washing. So, good morning, ma'am. I am Bea Bianca Rodriguez, your student nurse for today. So, before starting to our procedure, please state your name and birthday first.
I'm Angeline Flores, and my birthday is November 16, 2000.
Okay, ma'am. So today I will be assessing your abdomen. So I'm going to touch some part of your body. Is it okay with you?
Yes,
May I ask some question?
sure.
May I know your bowel history? Kung ilang beses ka tumatay kada araw?
2 times a day.
Or nautot ka na ba ngayon?
Yes.
Okay, so how about your change in appetite?
No.
How about previous or current condition or treatment?
None.
Okay, thank you, ma'am. Now we're going to observe for contour and symmetry. Also to observe the peristalsis or aortic pulsation and observe for scars, rashes, and lesions. So first, I'm going to auscultate to hear the bowel sounds of the patient. Let's start auscultating the right lower quadrant. So for the second procedure, I'm going to percuss your abdomen. So starting to your left lower quadrant, I'm going to percuss it using my 2 fingers. So let's check for the fluid sheet. So we're going to place our both hands side of the abdomen of the patient, then push it to the right. So you're gonna feel a fluid at the right side of your abdomen. Put your hand above the abdomen. That is for the blunt percussion. And that is for the blunt percussion. Next one is, I'm going to strike the abdomen of the patient like this. So I'm going to put my hand above the abdomen and then strike. Do you feel any feel, ma'am?
No.
Okay, so third, umihi ka na po ba?
Yes.
So empty na po yung bladder nyo?
Yes.
Okay. So the next one is I'm going to palpate the abdomen of the patient. So I'm going to check for the masses, nodules, and tenderness. So I'm going to start at the right lower quadrant of the abdomen in a circular way. So now involuntary movement is present while palpating the abdomen of the patient. So next is I'm going to palpate the aorta of the patient. So we can use the valve of the stethoscope, this one. So the aorta is in the midline of the body. And next I am going to check for the liver. So we can forecast it until it becomes dull or do a scratch test using stats. We can also put our hand at the back of the patient until you find the costovertebral angle of the patient. So I am going to put my hand under your back. Okay, so inhale, exhale, inhale, exhale, inhale, exhale, inhale. So next is we're going to check for the kidney. To palpate the kidneys. So now I'm going to palpate the bladder, right below the umbilicus. And lastly, I'm going to palpate the spleen of the patient. I'm going to put my hands at the side of the abdomen of the patient. So inhale, exhale. Inhale, exhale. So the spleen is not palpable. So now I'm going to assess for rebound tenderness. So I'm going to palpate the right lower quadrant, but we can suspect appendicitis if the right lower quadrant hurt. So do you feel any pain, ma'am?
None.
Okay, so going to assess for the roving sign. We'll also be checking for the appendicitis. So I'm going to press the left lower quadrant of the patient, and if she feel any pain at the right lower quadrant, then she has an appendicitis. So I'm going to pressure left lower quadrant. Do you feel any pain, ma'am?
None.
Okay. Going to assess for the SOA sign. So we'll be asking the patient to raise her right leg. So please raise your right leg. So do you feel any pain?
None.
Okay. So lastly, we'll be checking the obturator sign. So I'm going to press the lower quadrant of the abdomen. So dapat walang pain na mararamdaman. Nakakaramdam po kayo sa
Wala.
So, perform for hypersensitivity test. So, kapag po ba hinahawakan ko po kayo, is nakakaramdam po kayo ng pain.
Hindi na.
Okay. Pwede na po kayong tumayo. So, good news, ma'am. All the tests result is negative. Thank you. Don't forget to do